Welcome to this edition of the American College of Surgeons Bulletin Brief from the Frontline, Surgeons' Voices. With me today, it's with pleasure that I introduce Dr. Danielle Walsh. Dr. Walsh is the lead of our quality pillar for the Board of Governors at the American College of Surgeons. Welcome, Dr. Walsh.
Thanks. It's great to be here today.
Well, it's great that you've taken the time to be with us. You've done a lot with the governors. I hear the reports every month, and you've done a tremendous amount of work with the quality pillar, which is why I wanted to chat with you a little bit about the Quality and Safety Conference. And maybe you can start a little bit just telling us about the value of that conference to practicing surgeons, and until recently you were the program director, also to surgical trainees.
Sure. Thanks. Really appreciate the opportunity. So, when this conference started, it was really aimed at the people who were doing the NSQIP programs, the database programs. But this year is really revolutionary. So rather than surgeons think about this quality conference as being dedicated to a group of people where it's just their everyday work to do quality, this is meant for everyone, every surgeon, every resident, every nurse, every medical student, anybody who's in surgery. Because the concept is that quality needs to be part of your everyday practice. It's not something separate you do on the side. It's something that you integrate into every decision and every patient experience that you're working on. And so what's beautiful about the conference is that that entire spectrum of education and opportunities to learn, change, and improve and make your patient do better is part of this conference. So let's start with that education part. So I have residents, people right out of medical school, and they understand a little bit about the fundamentals. Many of them have done a little bit of education, but many of us never did that. It wasn't part of our medical school. So there is now a series of 6 lectures online there. That's the basics of QI. How do you start with quality? What do we mean by quality? How is that different than research? And those are skills and tools that I can then use for my residents who are just coming into training. For those who've been out of the residency world for a little while, the ACGME now requires that all residents do a quality project as part of their education. And if we want them to succeed in doing that and like it and understand it and have it make a difference, we need to give them those fundamentals. And that's one of the things that's new. And it's meant for residents, but it's meant for you, the general surgeon too, who really never got that background before. The series of 6 lectures is on demand. You can pull it up yourself, and it's going to be turned into a more formal program for the individual surgeon to certify and get credentialed if they wish in quality. But if you don't want to go that far, that's great. Just learn the fundamentals and how you can integrate quality into your everyday practice. It's also a great tool for the whole team. So let's say you are getting your NSQIP data back, but how do I turn this into something that makes a difference? How do I take that needs improvement area and move it toward the next scope, especially when I don't have time to do this? I'm in the OR all day. I need my entire team to really understand those fundamentals. So within the quality conference, there's even nursing CMEs and nursing-based education and nursing-based projects where you can introduce the rest of your team, nurses, physician's assistants, advanced practitioners of all types, CRNAs, into that perioperative spectrum of improving the quality of care. And it's free. So you get all of them to go in, create a login, and they can educate themselves. And once everybody kind of has that mindset, those goggles of quality on, they're really hard to take off. And if every member of your team can contribute a little bit, you can make a huge difference in your practice. So there's resident education, there's individual surgeon education, there's nursing and allied professional education. And I think there's really content in there that our administrators need to hear about, our quality non-surgeon professionals, our CMOs and chief quality officers that aren't surgeons. There is a fantastic new program within there. The American College of Surgeons is having a quality certification. It's rolled out. You can find an entire panel discussion about it. And that's where they can learn how surgical quality should fit into their institution and how they can be part of making the care of our surgical patients better. So I think that this is really a wide encompassing thing, and I really encourage everyone to move beyond just that designated quality person and really dive into the areas that can make a difference in your practice, no matter what level you're at.
Well, thank you for those insights, and your enthusiasm is absolutely positively infectious in a wonderful way. I think we should have a new pillar too, something like public relations as well, because you do a great job of explaining the value of the college educational offerings. It's tremendous, and I agree with everything you've said. So let's talk a little bit about being able to perhaps implement some of this free education of which nurses and residents and medical students and staff can avail themselves. And maybe you can give us some examples. You spoke a little bit about the quality program, and we were actually site visited not too long ago by the ACS for the QVP, and it was a tremendous experience. But so maybe not that one, pick something else and talk about sessions at the meeting that can be adapted to practice at home.
So one of the sessions that you can look into is actually in the pediatric surgeon section. So as a pediatric surgeon, it was one that I was really interested. And we have a collaborative within the pediatric surgery NSQIP. That's the Antibiotic Collaborative. So people have been using prophylactic antibiotics and following CMS standards for a long time. But that doesn't mean that we're always meeting them for all of our other cases. So there's times we need them, times we don't need them. And especially in the pediatric world, you got problems with allergies, you got problems with dosing. How often do you redose them in the operating room? So we used our data from the NSQIP report and identified that we had a higher than expected superficial site infection rate. And when we started drilling down on them, we noted that the majority of the patients who were getting them either got the wrong antibiotic, didn't get it redosed, got it at the wrong dose, or didn't get anything. And so this gave us an opportunity. When you're talking about intraoperative redosing, you got to involve your CRNAs and your anesthesiologists and that perioperative team. You got to involve your pharmacy to make sure the doses are correct. You got to look at everything from the EMR and how it's put in, and then your local milieu. So talking to our infection control and pathology specialists, what resistance do we see in this area? And we put together an antibiotic card that simply gets clipped onto every anesthesia cart in the OR. Nobody has to go in a computer and look it up. Nobody has to look up the revisions of it, but we got everyone to buy in and send this around. And lo and behold, within two years of doing this, we've gotten rid of our problem. We've got rid of our surgical site infection issue. And if we do have them, they weren't related to misuse of it. So that's an example of how you can take your data, you can create a project that's pretty straightforward. You can get everyone to buy into it, and you really make a difference in your patient's care. And so there's tons of projects like that. If you think of your own institution and what are your weak spots, what are the frustration spots even in your pre-op holding area? You know, are you frustrated because your cases are getting canceled in advance? There's going to be something in this conference that can speak to that problem and give you a structure and an example of how you can implement it in your own place.
That's wonderful. And I suppose to close the loop, the resident who's taken on that particular initiative as their QI project would then submit the abstract for next year's 2022 Quality and Safety Conference so that we can help celebrate their triumphs and see what they did.
Exactly. And they can submit it at their state level chapter meeting as well, so they can get double credit. So lots of opportunity to turn that quality work into scholarly work and help advance careers as well.
That's great. And speaking of states, you're in an area of the country, in a state where you're in the epicenter of a large rural area. So you're in Greenville. And your institution there may have challenges, and not only your institution, but the institutions around you in the smaller areas, challenges in implementation of quality programs, which may be different than are in major metropolitan and urban areas of the country. And you know, perhaps you could talk a little bit about those, maybe even including collaboratives and how some of the quality collaboratives can help solve some of those problems and improve the outcomes for all patients.
Sure. So certainly I'm in Greenville, North Carolina, which is less than 100,000 population, but we have a huge medical center. It's almost 1,000 beds, but we serve a largely 29 county rural area. It's impoverished. It's underserved. There's a shortage of doctors. Most patients have to use their county medical department. They don't have transportation to get to us. We are in the midst of the diabetes and tobacco belt of the southern component. And so that creates tremendous opportunity to really improve the care of your patients' lives by using quality. So we've also found that the quality given out in the community really impacts the quality that we can give here. So if your patients are getting tons of CT scans, or my pediatric patients getting tons of CT scans out in the community before they get here, the hit to quality has already occurred before they made it here. And that set an imperative on our division and our department to outreach to these smaller centers. So we actually go out and visit pediatric practices. We go out and visit other institutions, emergency rooms, and we talk to them about what we're doing here. We build protocols for them based on what resources they have. So if they don't have someone who can do an ultrasound at their center, then we shouldn't be telling you do an ultrasound, because it doesn't fix their quality problem. We go out and hear, what are your challenges? How is it that you come to this decision? How can we reduce this CT scan rate and create a patient pathway for your institution, for your patients, that's going to give them the best care, lower your resource overhead, create value, and then let us take the ones that really need to come there. So we balanced all of those things. So outreach is a tremendous opportunity. And these people want it. They want to do a good job. They don't have the infrastructure necessarily where they are. So if we as surgeons can understand that quality process, understand pathways, understand its impact to the patient, and then reach out to where places can do better, we can be that messenger. That said, many of the college processes and programs are intended for rural surgery programs as well. These critical access programs and the surgeons who serve them are a tremendous benefit to that community. And we want to make sure we support them in a very positive way. So the college is very thoughtful in working with its rural surgery committee to try and make sure that we put tools in place for the small and for the big. And we develop relationships that allow us to cross-pollinate between them. Our state chapter is fantastic about that. This is when I get to talk to many of those community surgeons who say, you know, is it okay if I do an appy on an 18-year-old, a 17-year-old, or a 13-year-old? But when do you think it'd be better that I send it? When do I push and when do I back off? Those relationships are really important. So you can create them at your state meetings, you can create them at the national meetings, but within the safety conference, you can actually do it online. You can put those questions to the speakers and to the audience, and we can talk about what different places do. So that's how we can support those smaller centers.
Fantastic. Really, really good information. Again, I love your enthusiasm. Now, I don't think this interview would be complete without asking you to tell us a little bit about the poster over your right shoulder, because it is very unique.
So yeah, this is a little logo that's was created by my daughter and I in order to just do something fun for our surgery residents. So this smiley surgeon face was created and put on t-shirts for all of my surgery residents kind of at the mid-COVID part, as we care about you, your team, and this is a fun way to smile. And so the shirts end up underneath scrubs and things like that. But they translated the emblem onto a poster for me, and my team was kind enough to send me some happy messages to sign me off and send me off as at the end of my program director years. So I'm now a program director emeritus, and very grateful to have had the opportunity to lead my residents. But this is our happy side.
Fantastic. I appreciate very much your time today. Leave you with any parting words you might have for us before we bid adieu.
And again, this is, if you as a surgeon, it's not just about how you operate technically. It's not just about your decision making and evaluating and treating patients. We all know that the system of care that we flow through and the patient experience depend on quality. And this is your chance to get a better understanding of how you can leverage the resources of the ACS and how you can educate yourself and the rest of the team on improving the value and the care that you give to everyone else. So don't think of it as separate. Think of it as, I got to integrate this into every decision that I make for improving patient care.
Thank you very much. Very, very compelling indeed. And anybody who's not already registered for the Quality and Safety Conference, I urge you to do it. The material is still online. Huge opportunities to educate yourself, your residents, your medical students, your other healthcare workers, and please heed Dr. Walsh's advice today. Thanks again.
Awesome. Have a great day. Thank you.
You too.